Okay, this is my IVPD back and push competency. The first thing we're going to want to do is we're going to want to compare our order to our MAR and make sure we have the right patient name, the right medicine, the right time, the right dose, the right route, and right administration. Make sure it's the right medication. And we're going to want to check for allergies. Then we're going to want to compare our medications to the MAR to make sure that they're the right meds. We have Zantac and we have Lanoxin. We have 50 milligrams of Zantac. So for Zantac, we're going to want to watch and make sure that we have correct and adequate renal function, make sure it's not interfering with any, we don't have kidney failure or anything like that. And for digoxin, we're going to want to make sure that we do the apical pulse rate for 1 minute and make sure it's above 60, and we're going to want to watch and make sure that it's in good therapeutic level. Okay, we're going to want to make sure we have the correct solution. That's what we did. We're going to want to make sure that we have the correct medication and dosage. We're going to clean our hands before we get all of our stuff together. Okay. And we're going to want to make sure that we clean. Okay, for our digoxin, we're going to pull up 0.5 milliliters, and so we're in that, you give that over 5 minutes, so you would do 0.1 milliliters a minute. I'll go ahead and pull that up. Label the medication, like the patient's name and the medication and the dose we're giving. We're going to again compare it to MAR, make sure it's correct. And we've got our Zantac. We're going to go ahead and mix it, and it's going to be pre-mixed. And we're going to make sure we have our label on it, and then we have the patient's name and the dosage that we're giving. We're going to compare it back to the MAR and make sure that it's correct and accurate. Now that we have our medication confirmed and it's right, we're going to go on to our patient's room and make sure that we have all our correct stuff. So we're going to want to make sure we have alcohol swabs to clean the ports before we give the meds, and we always want to check allergies again when we get in the patient's room and make sure that nothing is interfering with the meds. And we're going to get in there. I use our 2 identifiers with our patient. We're going to want to check the name, date of birth, compared to our MAR, and then we're going to ask the patient if they have any allergies, and make sure that nothing is interfering with the meds. Then we're going to wash our hands, put on some gloves before we give it. We're going to want to make sure that the meds are correct for the right patient. And we're going to want to look at the IV and make sure that it's patent. And make sure the IV's patent. We're going to want to pull this down, make sure we have it's still working good, there's no blood return or anything like that. We've washed our hands and put on gloves first. And so before that, we're going to check this, make sure it's not swollen or anything, or it's not infiltrated. Okay, before we give our medications, we're going to want to make sure that it's the correct order. And okay. Now we're going to go into circular medications. We're going to clean the ports, put on gloves. We're going to go ahead and do our flush first. And we're going to want to do the flush on the port closest to the IV port and make sure that it's the closest one. And the compatibility, we want to make sure that it's correct for both of the medications before we even go to our room. And then we're going to want to make sure that we always explain the procedure to the patient and make sure that they know what's going on and just go in there and start working on them. And you also got to make sure that that is compatible with these or these to make sure you don't have to stop it or anything like that. Okay, we're going to do this push closest to the port first. We've already made sure that it's still patented and it's still good, so we're going to, even though it is compatible, we're going to want to clamp so it doesn't flow back into the primary tubing. We're going to want to clean this with an alcohol swab while we have gloves on, but these do not fit my fingers. So okay, now that we've cleaned our thing, we're going to go ahead and give our push, and it's 0.5 milliliters, and we get about 5 minutes, so we're going to do 1 milliliter a minute using the push and pause technique. And go ahead and connect this, and we're going to give 1 milliliter over a minute. So we're going to stop, hold on just a minute, and then we're just going to keep doing that for the other 0.4 milliliters over 4 minutes, 1 a minute. So after that, we would want to just unplug it after you're done. And since it was compatible, we did not have to flush before. And so now that we have that done, we're just going to want to make sure that it is still a patent IV. We're going to want to monitor our patient, monitor their heart rate and their blood pressure, and make sure that they're still breathing. Okay, so after we've done our IV push and we've got it done, we're going to want to go to our piggyback. And we're going to want to, our piggyback, we're going to want to prime it before we get to the room in the nurse's station. I'm going to clamp this first so we don't just waste all of our medication. I'm going to plug this in. Make sure it's been right. I'm going to make sure it's primed accurately, get rid of all of the bubbles. Okay, now that that's done, we're going to again check the MAR, make sure this is a safe dose, is compatible with your fluids, and it's not interfering with anything. And it is compatible with D5W. So before we get this, we're going to want to, again, like I said, check for patency, make sure it's going good. We're going to want to lower this and check for return. And we're going to lower our primary bag because of gravity. We want the piggyback to go in. Okay. We're going to want to have on gloves, wash your hands, of course. Then we're going to want to take an alcohol swab and clean our port that is closest to the primary bag that is being infused. Clean it. Okay. I want to make sure that this is plugged in. And we're going to hang our IVP bag above the primary bag. And we're going to want to control it with the primary tubing clamp. We don't control it with this one, we do it with this one. So we would set it at 25 drops a minute. And we would also set it at, and if it was on a pump, we would do 150 milliliters an hour. And so we would want to make sure that it is infusing correctly and we don't have any redness or any swelling or any infiltration of the IV or the vein or the arm or anything. And we might want to make sure that we've explained both procedures to the patient and we have everything in order. So now that we've set this by the primary tubing, and once it's done, well, you're going to give the piggyback over 20 minutes with milliliters an hour. And so make sure that this would go over 20 minutes. So we do that 150 milliliters an hour and then 25 drops a minute. Okay, now that we're going to make sure that it's still, the arm is still good. And after that, when we're done, we're going to unplug, we're going to clamp this one off. And then we're going to unplug this. And we're going to want to waste this into the garbage. And then we would want to hang this back up high where it was before we started. And then we would want to reset the rate for the primary infusion at what the doctor had. And set this back at what the doctor had it as is ordered, as drops per minute or milliliters an hour, whatever the doctor had ordered before this. Okay, then after that is good, we're going to want to make sure that make sure that this is still flowing properly, and there's no swelling, no infiltration, it's no irritation, and it's unclamped, none of these are clamped, and this is set back at whatever the doctor had ordered at first. And then we would want to sign everything, make sure that we've documented correctly, and all of our bags, we want to make sure that all of our fluid bags are in date, the fluids are still clear, and there's nothing floating around in it, and make sure there's no cracks in the bag. But you would want to do that all in the nurse's station before you go into the patient's room. So just make sure everything is not expired, clear, and just has good function and what you would do for your IVP badge.